Hello relatives, welcome to this week's Schlagbite for the week February 22nd, 2010, entitled Sicker and Sicker. The current recession is causing budget cuts in cities all over America. In Phoenix, my hometown, the city council is considering closing 15 recreation centers, 5 large community centers, 5 senior centers, 6 libraries, 3 sports complexes, and eliminating police positions that work closely with neighborhood groups. If this happens, we will get sicker and sicker, because we'll be closing down the #1 health promotion projects in this or any other city. Those city services are what give us neighborhoods a sense of small-town warmth, security, and camaraderie. Those are the places where kids are shooting hoops, where seniors play cards, and mothers hang out while their kids participate in affordable after-school dance programs. Closing these places may help reduce the budget deficit, but we will pay for it in the long run in increased healthcare costs. With fewer places to hang out and connect, the old will become more isolated, and without stimulation, they'll get depressed and confused much faster. Then they'll become patients, and they'll be sent to a doctor who will make a diagnosis and prescribe drugs. These medications are likely to make them even more confused and agitated. The young will, of course, find other, perhaps less savory ways to release their energies, but with fewer places to get out their youthful enthusiasm and competitiveness, you can be sure that they will get antsy, and that some will be diagnosed with ADD or ADHD, for which they too will be medicated and also have terrible potential side effects. Instead of closing these centers, we ought to be creating more such community services as ways of promoting health. Investing in communities is a real step in true healthcare reform. It moves us from the current interventional system in which you have to get sick before anybody pays attention to you. Then you get a diagnosis, which of course comes with its own number, because that's the only way that a provider can get reimbursed. This is a paradigm of healthcare delivery that's predicated on making people sick. Are you aware that 25% of all Americans now carry a mental illness diagnosis? It's ridiculous! And it is the result of declaring unacceptable feelings or behaviors as diseases. Let's rise up, Americans, build communities instead of tearing out their hearts, because they can keep us healthy. Stand up and make this statement about real healthcare reform, about a paradigm shift from a model based on intervention and treatment to one based on prevention and healing. Find out if this is happening under the guise of budget cuts in your city, and go to public meetings, raise the issue, and ensure that it's addressed in a public forum. Those are my thoughts for this week. Have a great week. For those of you in the Phoenix area and are interested in public meetings about this budget deficit and healthcare crisis, check my written Schlagbite, and you will see telephone numbers and email addresses. Have a wonderful week. Remember, we are all connected. Nobody makes it alone. I say this for all my relations. Mitakwiyasi.